So here we are. The aim today is to explain the changes in the NHS, but I'm also going to do some other work. I'm going to give you a bit of an update on where we are with the NHS work, which, as you know, we do in partnership with our colleagues at Action for Carers and at Surrey County Council. And also my colleague Chris is here, Chris Costa from Continuing Healthcare. And we're going to have a workshop later this morning to talk to you a little bit about what we've been doing to try and support carers in continuing healthcare. Okay, so just to put a bit of context around this, the changes that are going to occur are the biggest in 65 years, well, since the NHS started. And what it means, without a political spin on it, is the government wants to introduce a sort of marketplace model for providing care. I mean, at the moment, the NHS has a monopoly of care, and potentially what this new change and structure will mean that you will have more choice as both patients and carers to source your own services, obviously with the help and guidance of your GPs. The funding, 80% of the funding, as you will see, will be through the clinical commissioning groups. Now, those are the groups that your GPs will be hosting, and they will, and I'll go on to some later slides that will talk about exactly the services that they will be commissioning. Commissioning basically means what they're going to purchase, what services they're going to purchase. 20% of the budget is going to be held by the NHS National Commissioning Board, but they will delegate that to local area teams, and we have one in Surrey and Sussex. It covers both areas. The overall budget is 95.6 billion, which represents 2.6% inflation growth. I would just add the caveat to that actually health inflation runs at about 5%. So I'll let you read into that whatever you would like. And then just a quick reference about public health. I'm actually based in the public health team at the moment, and part of that is that public health, and for the fossils around here, maybe John, he might well remember when public health was with the local authority, but I think everyone's quite pleased that public health is moving back to Surrey County Council, and actually we're in the middle of transferring those services now, so from the 1st of April, public health will be back. I'll be in trouble for that comment later. Okay, so
you already are, actually.
The Health and Wellbeing Boards, I'm not going to go into too much discussion about them, but basically they're the overarching strategic authority for both health and social care. And they are currently being rolled out and established, and we have one in Surrey, and they are currently looking at the priorities for the health and wellbeing strategy. I'm not going to go into detail about that today because you may or have already picked up some information about that consultation. And also just to quickly mention the Health Watch. Health Watch is replacing what we used to call Surrey Links, a local involvement network, which replaced PPI, Patient and Public Involvement, which replaced CHC, which was, I don't know, I'm losing the plot, but anyway, we keep reinventing the wheel on this one, but Health Watch will have a monitoring duty, and in exactly the same way that Links has, and it will be health and social care. I know social care is not indicated in the title, but it is important to know that. And as I've just mentioned previously, there is a new health and wellbeing strategy being generated at the moment, so you can get involved with that. Okay. Oh, and I should just quickly mention the Complaints Advocacy Service. There is a new NHS Complaints Advocacy Service. It is not yet clear how this is going to be worked in a local context. But again, as soon as I have those contacts and that information, I will share it with you. Right. Now, in Surrey, our GPs, and we have 130 odd practices, have come together, and we have out of that 5 CCGs. I know it says 6, But this little one on the corner here, Farnham, there are 5 practices in that, but they have aligned themselves to a CCG in North East Hampshire. That's not to say that we don't include the Farnham lot, but I just felt it was helpful for you to see the visual geographical boundaries. So for you here in the northwest, obviously Surrey Heath and the northwest one, which is the yellow one, are the ones that's going to mean something to you. And here we go. I thought again it would be quite useful just for you to see. I know I've just referenced the fact that there are 130 practices, and any one of you who can do quick maths will say, hang on Debbie, you haven't added that correct. This slide was created some time back, and there's been some mergers and closures of surgery since then. But anyway, I did think it'd be helpful again for you to see the number of patients per CCG, and also to just get a feel for your area, because I appreciate that some of you may not be from the northwest area. But these are the organisations now who are going to hold 80% of the budget. Do you remember that's what I said earlier about the funding? And these are the ones who are going to be buying your services. And they are all led by GPs. Surrey Downs is led by Dr. Jonathan Richards. East is led by Joe McGilligan. Guildford and Waverley by David Eyre Brooks. And Surrey Heath by Andy Brooks. Northwest, any of you know Liz Lawn, Dr. Liz Lawn? Well, she's your lead here. And for that little one in Farnham, it's going to be led by Jane Dempster, who's actually with the North East Hands. These clinical commissioning groups will in turn use the services of commissioning support units. They're sort of abbreviated now as CSUs. And we had hoped that we would just have one for Surrey, which would be an amalgamation of Surrey and Sussex working together. Basically, a CSU is doing that sort of back office work, the business management side of things. So the CCGs will make the decision about what services to commission, but then they will hand it on to the CSUs to actually deliver on the mechanics of it. I hope that sort of explains the two very different roles. As I say, we have actually got 3, and this is because the 5.5 CCGs in Surrey have decided to actually commission their support units with different commissioning support units. So we have Surrey and Sussex, but also we have the Southern CSU, which is actually based down in Eastleigh in Southampton, and they're going to be providing some support. And also, Northwest is going to a London CSU. Okay, so I thought again, looking at the amounts of money, I'm not going to dwell too long on this, but I thought you'd like to know per million how much each of your GPs have in their kitty to spend on services. But I'm going to put a huge caveat on that. Medical accounts have estimated that there is an actual overall drop of 10% in surgery incomes from the 1st of April. So those figures may look very healthy, but actually they represent a 10% drop. Okay. So now, what are we doing in Surrey? So the PCT at the moment hosts the money that we spend on carers, and this is how it breaks down. So, as you can see, the main amount of funding that the NHS uses to support carers is around rates. And that money, I'm going to talk to you in a little bit about where it potentially might be going in the future. But I just thought it would be interesting for you to see what we're currently funding and to what amounts. Okay. I also thought it would be really useful for you to know, and a lot of people ask me, well Debbie, what is the role of the local clinical commissioning groups and what actual services will they be commissioning? And so the next few slides, what I've done is actually outline in detail the services that they will be commissioning. So look at that one in the middle, services for people with learning disabilities. I know for a fact that that one is going to be led by the North East Hampshire CCG for the whole of Surrey. And that's part of the mapping work that we're still doing. I have to say that a lot of the contracts have yet to be assigned. So as we go through this presentation, I'll give you the most up-to-date information I have. but it is far from complete at this stage. Okay. And again, I'm not sure as carers whether these are going to be all relevant to you, but certainly you can be the best deciders of that. The elective hospital care, I think, is obviously very important, and the rehabilitation services, so they'll be commissioning those. And here we are, other community services. So again, those are the ones that actually become in scope with the GP contract. And I just want to take this opportunity this morning to actually bring some of your awareness to the GP contract. I'm sure in the press you will have seen that there's been a lot of correspondence between GPs and government on the issue that the current number of indicators are considered to be unmanageable. I would just add, from a carer's point of view, that it's come under the radar that NICE, which is the National Institute of Clinical Excellence, are currently running an open consultation on actually removing carers from the GP contract for 2014 and 15. And I've asked Ron whether he could actually put the consultation on CarersNet to give you all the opportunity to have a look at the documents and make your own mind up about whether that is an effective step or a retrograde step. We, certainly at Surrey, through Jane and John, have been actively campaigning to actually increase the information that GPs provide us through their contract about how many carers they identify and recognise. If that is removed, I'm not really sure what message it actually gives to the GPs. And I will further add that the replacement indicator that is being suggested around linking carers' health checks for carers of people with dementia is very welcome, but actually it should be universal. All carers need carers' health checks, and in fact I'm surprised they haven't linked an indicator to actually GP carer breaks. But there we go, it's an open consultation, it ends on the 4th of February, and I really urge you to have a little look at it. Okay. The National Commissioning Board, I'm going to whiz through these ones because this is the overarching body, and although it may be of interest to you from a national point of view, these are being dealt with through Carers UK and Carers Trust, who are lobbying for carers representation on this. But I just felt it would be interesting for you to see what they're actually going to be about and what they're going to be spending the 20% of the NHS budget on. And here's a few more slides on those. You can see those later. Right. The National Commissioning Board is going to be governed by something called the NHS mandate. And for those of you who've been around a while and listened to me waffling on about NHS targets and indicators, you'll be aware of something called the National Operating Framework. This comes out every year annually in November, December time, and it basically tells the NHS and the people who work for it what we're supposed to do in the subsequent financial year. Now, there was a big consultation last year about what the mandate should include, and carers were, I think, objective 15 out of 22 objectives. And I think it's very important for you to see that carers have been represented in the mandate. These slides that are now following are about the outcome framework. And I appreciate this is getting very complex, but basically the outcomes framework tells us and gives us actually indicators that tell us what we have to report on. And as you will see throughout these indicators, there is a directive from national and through national policy that we have to do an awful lot better in the NHS to recognise, identify and support carers, and that they've really put it in quite strong language. I have to say, reading the outcomes framework, and I do have the document with me for anyone who would like to have a peruse, but I'd just say that actually the focus is still largely in with dementia, carers of people with dementia as reporting. Okay, so moving on, the role of the National Commissioning Board. I'm going to whiz through these two, Jane, if I may, because this just explains what services they will be commissioning. And now I'm just going to move into the Public Health Service. For those of you who are aware, as I said, Public Health is moving over to Surrey County Council. They've got a ring-fenced budget of £23,237,000. And it's fair to say, having done quite an extensive piece of work before Christmas on the Public Health Outcomes Framework, that carers are represented in all of their individual frameworks. So I will continue to work with my public health colleagues to ensure that carers get fair representation in those work streams. And again, I've just listed here because I did think it would be helpful for you to see exactly the difference between what public health do and what your GP will be commissioning. So some of those will be familiar with you. I think things like public mental health, so you may be aware of those, and certainly looking at some of those programs, I have worked I think I've worked across nearly all of them with my colleagues with regards to carers. Okay, so again, I'm going to whisk through this one. This is the Public Health Executive. Now, a bit like the National Commissioning Board sort of has the overriding lead over the GP CCGs, the Public Health Executive is a national body that has an overriding lead over the Public Health Services. So, separate to them, they will be taking on work that is currently being taken on by the Health Protection Agency. So infectious diseases is clearly one. So those of you who are familiar with things like bird flu and things like that, that's the sort of thing that's going to be covered by that. Okay, here's the question. What does this mean for Surrey? Okay, well, we're in a stage where we're currently negotiating for the carers' work and where it's going to sit in future. And having had sort of some quite long discussions with Jane and members of the Action for Carers Surrey team, and also with Surrey County Council, John and Ron and others, I think the feeling was in the summer that in future it might be best for carers to have a lead within one of the CCGs in Surrey. The NHS contracts that I've spoken to are all tied up in the voluntary sector funding portfolio, and agreement was achieved on the 20th of December that all that funding will be rolled over for another year. So we've got continuity of funding with all the carers stuff for another year, and I just want to say that because you do need the reassurance that business will carry on as usual while all these changes go on. I'm not 100% sure where that will sit, but what we're saying is, and what is good news for us, is our voluntary sector commissioning manager. I don't know if many of you know her. Her name's Tina Bird. Name familiar? Okay. Well, Tina's been around about 20 years working in this contracts side, so she's got a lot of history, and I work very closely with her. And that is great because actually she knows all the legacy stuff. So wherever she gets moved to and parachuted in, whichever organisation she ends up to, and it looks like it will be the Surrey and Sussex Commissioning School Unit, it means that we retain that knowledge, and that is hugely valuable and really good news. I would say that currently the CCG lead looking most likely to take over for carers across Surrey will probably be the southwest one, which is Guildford and Waverley. I've just said who that's likely to be. With regards to, so I've covered the commissioning side and that business support side, and that's the role that Tina will take wherever she ends up. With regards to the operational and development work, which is currently situated in public health, that's the bit that we're currently negotiating on, that we hope to move to a lead CCG. And we'll keep you updated and appraised of how that works out. I just threw this one in just to make sure you're still with me, really, after that rather long lecture on the changes. But I did think you'd be interested in the new census data. And for your areas, I mean, nationally there's about 11% increase. It's 6.5 million. For England, it's about 5.4 million. But what I would say of that is that in the national research, 80% of carers have said that their health has been negatively impacted because of their caring role. So, you know, you need to do the maths and look locally for your own areas. Obviously, Wellbeing's had the largest increase in Surrey, and I thought that would be interesting for you to see this morning. You've got a 13% increase at 9,202. Anyone from Surrey Heath here today? Okay, so for Surrey Heath, that was 12% at 7,894. Spelthorne? Yeah. You had a 12% increase too. That was 9,844. And last but not least, Runnymede? Great, nice to. Yours is the smallest percentage, 5% increase, so that was 7,402. I think these are very important indicators because what they project over the last decade is the level of increase of carers. And again, we must keep an eye on these figures, and certainly from a commissioning side for health, they need to know exactly how many carers they have in each CCG so as to align their services to support them. That's about all I'm going to say really on the restructuring, and I'm hoping that, you know, it's been a useful sort of, you know, trip down the lane. I did say to Ron when I was putting this presentation together, it's a bit like that children's thing, where's Wally, in the sense of where do you find carers in it all. It's still very much an emerging picture, and as I say, we'll try and keep you as best informed as we can. But I did want to talk to you about the partnership work that NHS Surrey has been doing with Action for Carers and with Surrey County Council, and just update you on some of the work. Those who were here last year would have heard me talk about the Adult Carers Health Survey, which is where we have taken all your 8 recommendations that you prioritise and where we have taken work forward. Some more successfully than others, but we all continue. So I'm just going to go through these, not all of them in huge detail, but some of them in more detail than others, and hopefully give you a picture of where we are. That's a great picture, isn't it? It's Ron on holiday, I think. Here we go. So the GP breaks, we support this to the tune of 1.3 million, and we have a super host organisation, Surrey Independent Living Council, who do all the administration of that. So, and Stephen Pugsley is the officer who does all the backroom work and is doing a great job. We did the pilot up to the end of March, and we produced an evaluation report. But I'm going to bring you right up to date to say that every surgery in Surrey now has signed up, and we heard from the Department of Health that we were the fastest county to get that sign up, so that was tremendous. Actually, it really shows a healthy state in our GP's knowledge of carers, that they were so willing to take up that service. 24th of December, the 2000th break referral went through to Stephen at the Silk office. And what that actually represents in real terms is that we've now spent £1 million. What I need to say today is we have an underspend still for this year. So if you meet the eligibility criteria, what I would suggest you do is have a conversation with your GP about asking him to refer you for a break. And the eligibility criteria is very, very simple. You have to be registered as a carer with your GP. You have to live in Surrey, your GP practice has to be in Surrey, and you have to be providing sort of regular and substantive care. The language around that is changing now. What they're talking more about is the number of hours. Well, not so much number of hours, but the impact that it has on you, because obviously each carer's circumstances will be different in what they're juggling with other family obligations and things. So it is very flexible, and I can't urge you enough. If you feel that you would like access to one of those breaks, talk to your GP. The largest age group to benefit is working age carers. That's absolutely terrific, and thank you to all our parent carers, and particularly to the national, local autistic societies who've done a huge amount to promote this with parent carers. I'm really, really pleased that they benefit. And I thought it'd be good for you to know that 31% of the breaks have gone to carers of people with dementia, which is really, really welcome. This is the end-of-life carer support service that we launched at the same time as the GP service. And it's basically managed by Jenny Crinkle. Do you know Jenny? She's the Crossroads manager for Woking and Surrey Heath. Anyone? No? Okay. Well, I had some conversation with Jenny yesterday, and she's given me a bit of an update on the figures. For Woking and Surrey Heath, for this year, so that's calendar year for January to December, no, not this year, gosh, 2012, sorry. For Woking and Surrey Heath, they supported 37 carers. For Guildford, 31, East Surrey, 50, Mid Surrey, 19, Elmbridge, 18, and Spelthorne, 38. So a total number of carers supported last year under this scheme were 193. In totality, that was over 4,626 hours. The benefit of supporting carers in end-of-life scenarios is where the choice of the patient is to die at home, and that choice is supported by their carer. This gives their carer some time out. And basically, it will fast-track any carer who is in that scenario. A referral will be responded to within 24 hours, and it will mean that they don't have to wait for respite care and other services. So it's a really, really welcome service.
Debbie, have you got any figures for Runnymede?
I knew you were going to ask that, and actually what I said to Jenny is, could she unpick that, because at the moment they are merged in with the others. So, but we'll get that for you. I knew that was going to come up today. Okay, carers health checks. This was your second priority from the adult carers health service. I just wanted to tell you about public health lead on carers health checks. And they started actually as a pilot. My colleague Shanaz Bano, who many of you will know, worked with actually taxi drivers and lorry drivers in Woking. And that was really, really interesting. But she's gone on to do some work around the carers, and thank you all to all the carer support organisations who've been involved in rolling this out, because we honestly couldn't have done it without you. But so far to date, we've done 225 checks. Now, this sounds, it's quite a small number, but from next year, we're hoping to get more of a bite of the pie on this. I know what happened as of December is the national money was pulled back, and we haven't been able to roll out these health checks yet in Surrey Heath or Waverley. But we will be making sure from the 1st of April that carers in those areas get an opportunity to get a health check. But of those 225 checks, that's the gender divide, obviously, between men and women. And they're clinical tests. They're not wellbeing tests. But so they're body mass index, blood pressure, glucose, cholesterol, and smoking levels. So typical sort of health checks. And they're actually provided not through the GP. We actually commissioned a private provider called HealthSmart. And the reason largely around that was financial. The GPs were happy to do it, but they wanted a lot more money than HealthSmart were. And with a very small amount of money, we weren't prepared to do that. So as of next year, we will be asking carers where they would like these health checks to take place. And it might be that you have a preferred option for that. I know that there's talk about just having them in the local supermarket when shopping goes on, things like that. I think for us, one of the things that we're really hoping to do is to work alongside our colleagues in social care. Because obviously there is a connection. If they're doing a carers assessment, it's an opportunity for them to raise awareness that health checks are available. But there is an eligibility criteria, and we do need to look at the way they currently manage their recording and their systems to see if we can actually make those arrangements possible. But I'm working with my colleague Catherine Telford, who I think is here today somewhere. Wave her hand in a minute. No? Oh, she's gone. But we'll be progressing that. Okay. This is some of the feedback. What I will say is that we had a number of carers who came along without any knowledge that they had any existing condition. And actually, one carer, we actually immediately taxied them to hospital. And so they weren't at all aware that they were at risk. And I think it's really important that because we know that carers neglect their own health, and I'll go back to that 80% say that, or report that caring has impact on their health, we need carers to take their own health seriously, and we have to do a much better job in raising awareness and supporting you. So there's been some immediate outcomes from this, and the feedback was really terrific. Okay, these are brief updates. I'm not sure how I'm doing on time. Coming right, fine. Counselling Services was your number 3. It was around bereavement counselling and relationship counselling. And so what we did is, because we needed to dig a little bit deeper into what the other areas were, and whether it was a case that people weren't aware of existing counselling services, whether they were aware of programs like the First Steps service that supports people. We did some in-depth research over 6 months, and an awful lot of you from the care support organisations supported that, and we had a couple of focus groups, which is very helpful, and that has all fed into Surrey County Council's Mental Health Public Value Review, and that is on our work blog to take forward this year. So we'll be working with our colleagues in mental health to look at how we can improve provision for carers and support around health and emotional support. The other work that you told us to get on with, and quite frankly has been around for years, I know my friend Janice is in the audience today and will say she's been working with the hospitals on hospital discharge and identifying carers in that for far too long. But basically what we did is, with Jane's help, we set up an NHS providers network, and we meet quarterly to share best practice amongst all the acutes and all the community providers. And we've done some really good work this year, and one of the things that we are really busy now with is rolling out the Carers Care Pathway. And this is basically a pathway, a generic pathway for carers. In some ways it is for you, but it is mainly for health professionals to support you. And what I have experienced, and certainly I know my colleague Ron has too, is that when we've been out to hospitals, it's not that the staff have been unwilling to support carers, they just simply don't know how to do it. And so this Carers Care Pathway gives them a one-stop shop. They've got their own website with all the referral forms on, and it's very clear about how they can support carers in 4 stages. So that's really, really making progress. And we've done a lot of other bits and bobs of work that actually, with a network, it really helps because we end up sharing best practice. And one of the inadvertent outcomes has been that there's been some healthy competition. So between the providers. Okay, very, very quickly, I'm still working with the boroughs and districts on getting carers included in the cohort of welfare recipients so that they can access concession cards. The reason why we haven't progressed that is because of the welfare reforms that you will all be very well aware of that are going on. But we continue to lobby. In fact, we had a paper that went out just before Christmas, and I think we're making progress with that one. Continuing healthcare. We set up a little task group in August to look at that and to see how we can improve support, not only to carers around their information needs, but also to care support staff who actually may be asked to advocate on behalf of carers. And today we're launching a pilot on a carers information, a booklet that we have drafted with lots of care involvement. And again, very big thanks to Janice, who has, she's been constantly responding and replying and feeding back to the development of this. And we have, I think, about 100 booklets available for you to take home today to look at and to feed back to us on. We really want to know what you think of it. End-of-life dementia carers advice and information project, that's really going very well. I met with Sue Tresman, who is the lead for this. It's a 1-year project, but basically it's around early care planning for carers of people with dementia. And again, it will be a full complement of resources to actually support the carer in end-of-life scenario. And just a little bit of information that the Surrey Carers information packs are being refreshed and they will now have an NHS branding, and there is a new health information leaflet for carers in that. And finally, I just thought it would be interesting for you to see last year 1,991 carers took up the opportunity of flu jab. Let's have a look around the room. Who had flu jab this year? Oh, that's good. Okay, that's great. Well, that's good. It means that we're getting out there, but I think we can do a lot better on that. So I'll let you know the figures. 1.8%, not huge, is it? But obviously better in this room. Very, very quickly, early findings of the Young Carers Health Survey. I'm going to whisk through these because they're not fully prepped. I have to thank my colleague Ron, who has put these in graph form for me, but I do need some work on it. I just wanted to say, and I'll let Jane whiz through these, and I will talk over them. You can have a look at them at your leisure, and we'll make sure they're available for that. But I just wanted you to know that we know young carers are vulnerable to at-risk behaviours, and the caveat to all of this is data that the Children's Society has provided. We know that last year 15,000 children were admitted for self-inflicted injuries. 169 of those were under the age of 10. I can't tell you how many of them were young carers, but we do know there is a correlation. We also know that eating disorders are on the rise. They're up by 10%. And last year, again, 3,800 children were admitted into hospital with an eating disorder. But more shockingly, there are 3 million children regularly experiencing the symptoms of depression. And again, we know there is a correlation for young carers and the stress they're under. And so what we're hoping with these slides, and when I've worked them up, these, as I say, these are very early findings, I'm hoping to put a report together by the end of March, which will be available on CarersNet and a few other sources, to actually advise commissioners on what support they need to be offering young carers. I think for me the most significant slide in there is that showed that 50% of the young carers who responded didn't even register with their GP and hadn't told their GP they were a young carer. So that's significant. That's me. You see, we've still got a pulse here in the NHS. Sorry, it's about 40 days till the bomb goes off, and then we're all homeless and off to the Battersea Dogs home. My contact details are here, and I would welcome any feedback and any questions. Thank you very much.
Thank you very much, Debbie. Should we give Debbie a round of applause?